The following program, Know the Cause, is paid for by Mediatrition Incorporated.
Judy, I believe it all has to do with your take on preventive medicine. To a doctor, a flu shot is preventive medicine. For me, more vitamin C and beta-glucan is preventive medicine.
It's called histoplasmosis. Most commonly, these fungi would be inhaled in the eastern half of America. Just go right through, Houston, Texas, and turn right, all the right side of America. That area is endemic to this Histoplasma capsulatum.
One of the big ones are we're looking for infections in the bone, okay? A lot of times those are missed. And the only way to truly see those infections in the bone is to do something we call a CBCT, okay?
They do the bypass operation. You are fixed. You can go ahead and eat whatever you want, no problem. Of course, eating whatever you want is what got you into trouble.
For the past 45 years, I have dedicated my life and my whole career to finding the root cause of disease. And I now know with certainty that we must play a role in our own health care. I'm a self-care advocate, and you know what? Every time you change your diet for the better, exercise, or swallow a nutritional supplement, so are you. Now welcome to Know the Cause.
Pulmonary infections. Folks, to you and me, that means lung problems, COPD, asthma, etc. I have a friend who's a pulmonary specialist who heard me lecture 4 or 5 years ago, wrote me an email that said that was the most important lecture of my life. I was so proud. And then he started doing bronchoscopy. So he'd go into the lungs of these patients, suspecting to find bacteria. You see, a pulmonologist gives 100% of their patients antibiotics first. He found that 80% of all these patients, hundreds of them, it wasn't bacteria at all, it was yeast. Houston, we have a problem. All these patients with yeast in their lungs are getting antibiotics. So let's discuss this. Pulmonary infections due to endemic fungi, I'll explain that. And then it said, this is Infectious Disease Special Edition, October 2021. Misdiagnosis is often the norm. Gee, I wonder why. Okay, let's keep going. Endemic fungi, here's what it means. Histoplasma capsulatum. This is a little dust-borne, soil-borne yeast or fungus. They're soil sand fungi that can cause a serious fungal disease called histoplasmosis. Most commonly, these fungi would be inhaled in the eastern half of America. Just go right through, Houston, Texas, and turn right, all the right side of America. That area is endemic to this Histoplasma capsulatum. Okay, it's in the waterways, it's in the soils, etc. There's another one, though, you need to know about. We call it Coccidio. Coccidioides immitis are soil and sand fungi that cause a serious fungal disease called coccidioidomycosis. Okay, most commonly these fungi would be inhaled in the lower left quadrant of America, from northern California to Texas. Texas is going to get it one way or the other. This is what is not taught in medical training. When wind blows, you ever seen that on television, no matter what country you're watching this in? When the wind blows, sub-Sahara, right throughout Phoenix, Arizona, big, huge windstorms, people walking in the streets, living in their homes with the window open, are inhaling all of this old compacted dust. Many people have antibodies to histo or coccidio in their bloodstream. Cases of pulmonary infections due to endemic fungi in the U.S. frequently are misdiagnosed. Not sometimes, not Wednesday mornings only, frequently are misdiagnosed, often because they are not considered in the differential. That's the diagnosis. They are relatively rare and can mimic other pulmonary diseases, so says this website. They're relatively rare? Let's keep going. If they are frequently misdiagnosed, how do scientists know they're rare, right? They're not finding them. They could be very, very common, and I think they are, folks. This is the way medicine works. Oh, fungus doesn't cause cancer. Yeah, there are hundreds of scientific reports going back decades that says it does, okay? But when you're not training young, brilliant kids in medical training this way, then they're not going to buy it, okay? When people, particularly immune-compromised people, get into high wind days and these molds are released from the soil and the sand, and blown into the air, inhalation can lead to mysterious lung problems. It is imperative for you to know that misdiagnosis is often the norm. That's what that research paper said. We're misdiagnosing these conditions. Doctors admit that misdiagnosing is common, so you must tell the doctor that you have had a breathing problem that might be linked with that week 2 years ago when the wind stirred up the mold, depending on where you live. Folks, here's the take-home message. If you've got an endemic mycosis, you live in Texas and there's both coccidio and histo, and you inhale, and now you get up in the morning and you can't talk and you feel miserable, and you go to the doctor, you're going on an antibiotic. But Doug, haven't we learned on Know the Cause that antibiotics fuel yeast and fungus? Every woman knows that if she takes a lot of antibiotics, she's vulnerable to a vaginal yeast infection. Okay, so understand the answer sometimes isn't antibiotics. Talk to your doctor if you suspect you moved into an old home. Folks, it's this simple. If your pillow is 3 years old, you've drooled and sweat on it, and now when your head hits that pillow, you've thrown the mold into the air. Consider this. You must not only kill it, you must starve it. The Kaufman 1 diet, study that a little bit. Between taking safe, natural antifungals or prescriptive, and the Kaufman diet, within a few weeks, you may feel much better. I hope that helps.
They do the bypass operation. You are fixed. You can go ahead and eat whatever you want, no problem. Of course, eating whatever you want is what got you into trouble.
I kind of want to go back to what you said about that antibiotic, okay? Because in these circumstances, an antibiotic is not going to do really anything for the problem.
Judy, I believe it all has to do with your take on preventive medicine. To a doctor, a flu shot is preventive medicine. For me, more vitamin C and beta-glucan is preventive medicine, so I don't need the flu shot because I may not get the flu. Okay, so why supplements over medicines? One, I take supplements to prevent the onset of illness. I believe in them. I've studied them for 50 years. I believe in them. Medication, would I take a medication? I did in 2017. You know my story. I was traveling, lecturing to doctors, one city after another, and on the way back to Dallas, the guy sitting in front of me had the flu, and he was coughing and hacking, and I got home and got the flu. 3 days later, I was really sick, and I drove down to a little, what do they call those little medical stop clinics, and I paid $75, and I knew what I wanted. I asked for it, and I got an antibiotic, took it for a few days, and boom, it was gone. Medicines and supplements can both be life-saving. By the way, just a little tidbit. This wasn't true 50 years ago. Today, as many people take pharmaceutical medication as take nutritional supplements, they are having an impact. There are many people like me who believe the proper supplements, the right exercise program, right, and the right diet means I don't go on to get ill. I have once in the past 50 years been very ill with that flu I got 3 years ago. Short of that, I haven't been, and I don't take any medicines. But I do take my supplements. I do know that my exercise program and sweating helps detoxify, and that my diet means I'm not feeding microorganisms that can be involved in illness, including cancer. Fungi, certain fungi do make poisons that do induce cancer. So just be careful. You'll find your thumbprint. I take supplements so I don't have to take medicines. Many people on medicines today, I'm reading, are also taking supplements. Good for you guys. What problems could the yeast syndrome create inside of me? Sick and Tired is the name of the book. Its author is here with us right now, Dr. John Trowbridge, a buddy of mine for 40 years.
Oh gosh, easily, Doug.
Yeah,
easily.
Thank you for being here today. But this was the big tamale, right?
Big tamale, yes.
This is the yeast syndrome.
Still a strong backlister for Bantam.
Do you have any idea how many of these you've sold?
Well over 1 million plus.
Yeah,
yes.
And yet you don't see Dr. John Trowbridge bestseller. You see somebody who's written a political book, sells 200,000, and that's a runaway bestseller.
Absolutely.
Welcome to the show. Thank you
you
for joining us. We do a live show in which we get questions, and some of them are better answered by a physician. I try to do the best I can to answer them. But
we know you struggle, but
we struggle,
yes,
but we get it done. And when I can't, I have your cell number.
That's exactly right.
Do I really have to? I get this from doctors. If we're going to prescribe antifungals or naturals, how important is the diet really? So this is a layperson. Do I really have to change the foods I eat in order to recover from the yeast syndrome?
I think the best answer comes from the cardiovascular surgeons, okay? They do the bypass operation. You are fixed. You can go ahead and eat whatever you want, no problem. Of course, eating whatever you want is what got you into trouble. People go, well, it's just food. No, in the old days we had farms. We now have agribusiness. In the old days we didn't have all the pollution which we are buried in now. The deal is that physicians are not trained in nutritional medicine. I got a master's degree in that because I didn't know what I was doing. I better find out. And the deal is that there are very specific things your body needs. If you got a racehorse, you wouldn't let him eat at McDonald's, okay? Right. Because he's too expensive to replace. The same thing with your car. You don't pour in just anything. Well, with what goes into our mouths, yes, that can determine things. Now, we know about genetics. That's the library of books you get from mom and dad to read, okay? But epigenetics, those are the life circumstances that dictate which of the books you pull off the shelf. So if you want to do different books, change the circumstances. The most fundamental circumstance that everyone can change is what they eat.
Yeah, that's so true. And yet we hear, your dad smoked, I'm worried about your heart, but I don't smoke. It makes no difference. That sperm became you. Folks, it's called epigenetics, around genetics. That's what's going on today. Did you think when you wrote this, I remember when you were writing this.
It was a struggle, yes.
Yes, it takes a long time to write a book that thick. Did you ever believe the success you would enjoy or the number of people you'd be able to help?
No, not at all. I just knew I needed to get this down. Patients were curious, and I needed to show them real, honest, scientific answers. I had one lady come in. I'd been taking care of her for about 1.5 years. She's in her older years, and I just come in, okay, what can I do for you today? Because she was never getting better. She said, I'm doing better. And I go, why? She's, I'm following the eating program you gave me.
Ta-da.
Okay, that's a great start.
Cause and effect.
Know the cause.
Know the cause.
Effect.
When I started this show, know the cause. What's know the cause? That doesn't say take my vitamin. Understand the etiology. Understand why the ear is ringing. Thank you for joining us today. Great book.
Thank you.
I'll never forget, I was in an airport in 2004. And I usually picked up a newspaper, a magazine, something to read on the flight. I don't even know where I was. But this magazine was sitting on the shelf. It was a Time magazine circa February 23rd, 2004. And the headline, the cover said, The Secret Killer. Well, I had to have that magazine, right? The surprising link between swelling and heart attack, cancer, Alzheimer's, and other diseases. What you can do to fight. Are you kidding me? They're thinking Alzheimer's, heart disease and cancer, swelling causes that? Folks, the genius will figure out what causes the swelling. Take wheat, mix it with a little water. Without the water, it blows away. With the water, it becomes a hard ball in 2 days, unless you add a cake of what? Thank you. Yeast. Inflammation. Let's talk about that, okay? Inflammation plays a key role in many diseases, some of which are becoming more and more common and severe. Chronic inflammatory diseases contribute to more than half of deaths worldwide. Nature Medicine, circa 2019, chronic swelling contribute to more than half. Folks, it's not the swelling. A doctor will look or do an autopsy and say, wow, their pericardium, their kidneys were really swollen, so inflammation killed them. What caused the inflammation? What makes bread rise? Okay, but what makes bread inflamed? Here we go, guys. Yeast. Can yeast make tiny animals and big people inflamed as it compresses nerves and causes pain? So many Americans, the first word out of many of your mouths, I wish we had little microphones in all your homes. I'll bet 50% of you, first thing we hear out of your mouth, ouch! Oh, it hurts. Oh, every time I turn. Can we become ouchless? Not if we go to a doctor and they say, wow, that's really inflamed under your arm. That's really, what? Anti-inflammatories without understanding the cause. Yeast can cause inflammation. Now, this one boggled my mind. It was in Brain Behavioral Immunology, February of 2018, if you want to look up the reference, issue number 68. In mouse studies, brewer's yeast is a potent inducer of fever, sickness behavior, and inflammation within the brain. Brewer's yeast. Folks, by the way, uric acid induces gout. What causes uric acid? Because Dr. Costantini, one of my friends with the World Health Organization, taught me and a bunch of other doctors at a lecture in Canada one time that uric acid isn't made by the human body. Well, it's on our SMAC test, our blood test, like glucose and cholesterol. There it is, uric acid. The human body doesn't make it? No. Fungus makes it. Isn't this fascinating? Brewer's yeast makes uric acid. And yet here we have doctors saying, well, you have gout because your uric acid is way up. What causes the uric acid? The genius of that. How do doctors tell if we're swollen inside? Some of you are laboratory people. I've talked with quite a few of you who are nurses, etc. And you know this for the past, what's it been? 20, 30 years, we've been doing C-reactive protein tests, blood tests. If the doctor says, wow, you're having some kidney and gallbladder and liver problems, and then he says, well, you have non-alcoholic fatty disease, fat, swelling is going on. What's the cause, folks? They'll give you a diagnosis and reach into the right front pocket, ready to prescribe. Why, doctor, why am I having this? I hope to teach you so you can share this in a private meeting with your doctor. The question inevitably will come up if you watch Know the Cause, and 100 million people can watch this show. Could fungus be the cause? On my website, just go to knowthecause.com, getting started, pull it down. The bottom one is the doctor's fungal protocol. Print it off, 2 pages. It's got science referenced. Hand it to your doctor. See, science does say, even the Center for Disease Control in America does say fungus can cause all this misery. Share that with your doctor. That's why I put it together. So you can have, here you go, the CRP blood test indicates human inflammation. Our data suggests that the finding of substantially elevated C-reactive protein blood test result may indicate a systemic fungal infection. This was in 2013. Okay, now, what do you do if you suffer from pain and you suspect, that's right, I lived in a moldy home, I used to drink too much, that's alcohol, that's fungus, I took way too many antibiotics when I was little. Consider what you haven't before. Yeast and fungi thrive on carbs and sugar. Starve them by lowering your carb intake. If not prescriptive antifungal meds, ask your doctor about using safe, inexpensive antifungal nutritional supplements, resveratrol, caprylic acid, vitamin D3, or vitamin B3, or garlic along with your new diet. But always, I don't know your medical history, always check with your doctor first. Okay, you feeling better on the diet and taking supplements or the doctor's medicine in 7 days? Congratulations, you may be close to proving that a yeast or fungal infection was causing your pain or your misery. More of the same should continue to help you improve. Folks, doctors don't learn this. Lots about bacteria, lots about virus. Very little about fungus, okay? And sometimes a careful history and asking, could I try some antifungals for a month and a special diet? It may go a long way. Hope that helps.
Folks, it is amazing what my guest right now, Dr. Josh Rowell, he's a dentist, but he's a biological dentist here in the Dallas area. It's amazing what he and I have heard. We're talking about asking the patient when it began. I did this all the time, and sometimes they wouldn't click any boxes. So you haven't been exposed to mold, you're not under a lot of stress, you weren't in a car wreck. I'm trying to figure out why this AFib, why this skin condition, why these migraines.
And then I learned from Dr. Lee Cowden, a cardiologist out here, always ask the patient if their symptoms began while or after a dental procedure. Welcome, Dr. Rowell. Because I know you ask your patients that also. How many of you seen get their root canal reversed, get their dental amalgam, this mercury maybe leaking into their system out, and a month later they come back and give you a big bear hug? It can happen. People can be slowly poisoned unknowingly by a wonderful dentist.
And that's right, Doug. And we see it a lot. We can see old restorations that are breaking down, that are slowly leaking, and we can get what's called toxic buildup over time. And the state of the world right now is not making that any better, unfortunately.
Right.
And yes, no, exactly. So with that, these old restorations can slowly be leaking, having problems over time, and leading to these toxic effects. One of the big ones are we're looking for infections in the bone. Okay, a lot of times those are missed, and the only way to truly see those infections in the bone is to do something we call a CBCT. Okay, it's a 3D scan where we can actually look right around the root of that tooth and see, are there any infections going on? A lot of times people have old root canals. I cannot tell you how many times these old root canals are reinfected. And again, we talked about that last time. It's just really hard for them to clean out these root canal systems in a way where there's not tissue left over and infection left over. And so we'll see these infections around the teeth, around these old root canals, sometimes around old extraction sites. Yeah. And patients have just been living with this for a long time. And it's not staying localized. And it's one of the easiest ways for bacteria to enter the bloodstream is through the mouth. Okay?
Really?
And so it can definitely be these toxic teeth just sitting there causing issues.
There's a pediatrician in California. He was our pediatrician many years ago. His name is Jay Gordon, still in practice. My kids are 43, he's still in practice. Great guy. He told Ruth and I one time that a dentist sees degeneration before a pediatrician does.
Oh, yeah.
And that is so, I got to think about that. Wait a minute, they don't have teeth. It's when they start getting teeth, and they love cereal, and they love sweets, and they get too much of it, breakdown. Are you saying when a root canal, we wouldn't know this without this scan, when a root canal begins to degenerate, so the bone, and then I would think the tissues, the viscera, the bloodstream, all are interactive, moving that bacteria around. Could I end up with a kidney infection or a bladder infection from leaking bacteria in my mouth?
Oh, it's definitely a possibility. I mean, these bacteria, when they enter the bloodstream and they get around, it's the same reason that a lot of your surgeons and things like that tell you, hey, you need to take an antibiotic prior to that. This has been a known thing, that bacteria enter the bloodstream through the mouth. So it's not a new story at all. But at the same time, we don't look with these 3D scans often enough to find out, okay, where are these hidden infections that have just never been diagnosed? And we can see these infections that people have probably had in there for 5+ years sometimes, and they're affecting other tissues, getting into the sinus. They're having sinus pain and chronic sinus problems, and it's just all because of a really horrible infected tooth.
Then, okay, so a round of antibiotics, maybe 2 rounds of antibiotics, you can clear up the infection. Are there supplements you like, diet changes you like that might help the patient?
Yes, there are. So D3K2 is going to be a huge supplement, but I kind of want to go back to what you said about that antibiotic, okay?
Yeah.
Because in these circumstances, an antibiotic is not going to do really anything for the problem. Okay, it would be the same thing as saying you have a big splinter in your arm, and then saying, and we're going to leave this there, but I'm going to give you an antibiotic. Right. It might help a little bit with the swelling and the bleeding and the infection that's around the site. But it's still there.
What do you do, Dr. Rowell?
So in cases like this, we're really talking to the patient about getting that tooth out, if necessary, getting that tooth out and doing something holistic there, like a ceramic implant or some other options, just depending on what's right for that specific patient.
I want to do another segment with you while you're here today. Thank you for driving in. About supplements. Are there really immune building, beta-glucan, my favorite? Are there diets? Are there supplements that dentists are recommending? Is sugar really bad? So folks, stay tuned. We're going to post on our website Dr. Rowell doing a longer segment with me, so you might want to look at knowthecause.com and see that. But that's an area I want to go in. Thank you for being here with us today.
No, thank you, Doug.
You bet.
Finally, it's on the market. The Kaufman Diet Guide, eating the right foods to feel great. Order a copy now, folks, and get one for a friend, because this is not only the thorough diet, but it's also the science behind the diet. Okay, so why supplements over medicines? One, I take supplements to prevent the onset of illness. I believe in them. I've studied them for 50 years. I believe in them. Medication, would I take a medication? I did in 2017.
One of the big ones are we're looking for infections in the bone, okay? A lot of times those are missed, and the only way to truly see those infections in the bone is to do something we call a CBCT, okay?
They do the bypass operation. You are fixed. You can go ahead and eat whatever you want, no problem. Of course, eating whatever you want is what got you into trouble.
Brewer's yeast is a potent inducer of fever, sickness behavior, and inflammation within the brain. Brewer's yeast. Folks, by the way, uric acid induces gout. What causes uric acid?
The preceding program, Know the Cause, was paid for by Mediatrition Incorporated.